Oh, so what's up, brother? How you doing, baby? Chilling?
We decided to do this episode because
Damar Hamlin. I mean,
really sad, man.
It's so horrible. Did you watch the video?
I did. I actually watched it live.
Oh, it was horrible, bro. First of all, prayers to the Hamlin family, his parents, his family members, and they raised a lot of money to help him out. So a lot of people have been donating, but it was so scary the minute
he's such a cool kid. What was that story you were telling me about earlier?
Yeah, so you know what? One of my Michael Gallagher, one of my friends on Facebook, actually, he's into sports. He's a huge photographer. He's very well known in the area, and he posted in high school. Damar Hamlin was actually injured in one of the seasons towards his senior year. And, instead of him just sitting on the bench and, not doing anything, he actually became the water boy for his team.
That's so cool.
I thought that was an amazing story. And I'm like, what's
he's a team player.
He's an example to a lot of our young athletes.
That's why so many people were so sad. Yeah. When it happened, seeing the players' faces, I did feel like it was beautiful for football to see them come together, hug it out. I saw Joe Burrows and Allen were hugging that. All of that was beautiful for them to be united and be one, and not focus so much as let's chop each other's head off. Continue the game.
Or he should have done this. Or he should have done that.
That's the first time it's ever happened where they stopped the game fully.
I've never seen it before. Can
you imagine if I'm on your team and I get hit like that and I go into cardiac arrest? It's hard to play. How do you even play? It's very hard to play. And
it's terrifying, especially seeing your teammate or your friend
just collapse
on the floor.
What do you think happened? Let's get into that. So everybody's talking about what's actually happened.
Yeah.
We wanted to give our input as doctors to what we think happened, describe to, the physiology behind all of it.
Yeah. Well, I mean, first off, let's put away this whole, it was caused by a vaccine possibly.
If there wasn't a hit, I can understand people saying, I'm not saying that it would cause.
Yeah, of course.
Maybe
suddenly he was fine. Yeah, exactly.
But he got hit with the helmet. Yeah. And we know when you get hit and you get cardiac arrest.
Commotio cordis, right? 100%. And this is something that we typically read in med school. And we read a lot more about these young athletes with hypertrophic cardiomyopathy.
Man. A lot of those soccer players die suddenly.
Oh yeah, suddenly.
When I saw it, that's the first thing I thought.
It's terrifying, and it's very common in baseball players also because of the ball, hitting their chest. That blunt force, that blunt trauma that you get to the chest.
They had that hockey player that happened to.
Exactly.
2-3 weeks later, he was playing, which is crazy.
Exactly.
But I don't think he went to cardiac arrest when he got intubated and is in the ICU. I mean, that's a whole different ball game.
It is. And if you look at the registry for these type of cases, I mean, they average between 15 to 25 deaths per year. Now, luckily, the improvement in the survival rate in these patients have improved tremendously, and I think it's because of the advances of technology and the availability of the AED.
Yeah.
Right.
And they got on the field real quick. I don't think people understand. If you were just on a regular field playing and there was no medics, no medical personnel on the field, he would have not lived.
Yeah, there's no way. There's no way. I mean, with everything available, and he's still in critical condition, right?
Yeah.
So we have to take that into consideration. And typically, this type of injury typically happens on the exact time.
That's why it's so rare.
Exactly. Of the T wave, which we'll show a picture. So the P wave initially, if you look at an EKG, is typically the activity of the atrium, right? Squeezing, right? It's a contraction of the atrium. The QRS complex is the ventricles activating, of course. And then the T wave is right after the QRS complex is basically that repolarization kind of to restart and reset.
And that was the problem, is when you get hit right at that moment, it's supposed to restart.
Yep.
And that's why people go into arrhythmias. When you throw that off, that QRS, T wave, that's the pattern it has to be.
Yeah, for sure.
Unless you go into an arrhythmia, right?
Exactly. And that's something that a lot of people need to understand, that it's our heart is an electric pump. It's all through electric activity. And of course, blood flow and blood supply. But if you take that electric activity, that good QRS, T wave out of activity, then it's going to jump into this ventricular fibrillation type, dancing type heart rhythm, which is extremely dangerous. And the scary part is he was out for approximately, they say CPR, they did CPR on him for about 9 minutes.
Scary. Now, and that's why when you go into cardiac arrest, and I think that's what people need to understand. What is cardiac arrest?
Yep.
What actually happened? So he got hit, right? You said it was the exact moment at that T wave where it was going, the repolarization, right? And then right at that moment, he got hit, he fell.
Yep.
He went into VFib. This is what I think. Nobody knows exactly what happened. He went into VFib, and then the second he stood up, he went into cardiac arrest.
Yep,
exactly. Which was scary moment, man. And that's why they went straight into doing CPR. And
exactly. And luckily, they did CPR. And I think a lot of the reason why he's still, even though he's
100%.
intubated, is because of the availability of the AED and the CPR that was initiated as soon as it happened.
And thank you to all the medical personnel that were on the field.
Absolutely.
You guys made a big difference. This is when, times where you shine and you go there and help people. Exactly. He would not be alive if they were not.
I agree.
And we don't know if he had any heart conditions before. Mm-hmm. I personally believe that every single athlete should get at least an echocardiogram.
I agree.
To see if that chamber is thick where they get that hypertrophic cardiomyopathy.
Absolutely.
Just to screen them, just to watch out. Because we really don't know if he had a cardiac condition and then when he got hit, and it kind of it activated it.
It can be exacerbated. So me personally, I don't think it's related to the vaccine. Yeah. And because of the blunt force trauma, I think most likely it's because of the commotio cordis.
What is commotio? Just tell people what that is exactly.
Commotio cordis is basically a cause of sudden death due to a blunt impact, typically in the heart region, kind of right above the sternum. And it has to be timed to kind of run into that. Now, of course, we can still cause a lot of damage to the heart, but commotio cordis really is more of an electric activity type situation rather than trauma or muscle damage to the actual heart. So it's basically like we talked about earlier, right before the repolarization of the T wave, you get the sudden blunt trauma at that specific time, which causes patients typically to go into ventricular fibrillation.
Cardiac arrest.
Which is cardiac arrest.
People need to understand the difference. This is one of the questions my friend asked me. He's like, well, what's the difference between cardiac arrest and a heart attack, right? Cardiac arrest,
it stops. It stops.
With a heart attack, your coronary arteries are being blocked, so that tissue is dying. So you're having a heart attack. It's two different things. They are. They are. Now you can go into cardiac arrest from a heart attack once that coronary artery is fully blocked. Then that's a whole different.
It is
story. So
it is, and that's why. And like I said earlier, around 15 to 25 cases every year of death, which is very unfortunate. And
how many people survived that? Was it like 58%?
58% survival.
That's kind of low, rate. Man.
And you know what? It used to be a lot lower.
Yeah. Well, now because people know CPR.
Exactly, because a lot of people know CPR.
Go
AEDs
learn your
available,
CPR, everyone. If you don't know, I had it at a time on a plane where a patient passed out. And they started doing CPR, and the guy was hypoglycemic,
like,
and his sugar dropped. And there's one of the girls like, "I'll do it," and she's doing CPR. I'm like, "What are you doing? That has a pulse." So like, don't go and try to help if you don't know what you're doing, because sometimes you can cause more harm.
I agree.
Right? Anyways, I'm not trying to get off topic. So we said 58% of the individuals survive that.
Yeah.
And you got to start as fast as possible.
Oh yeah, for sure. And you know what? The most important thing is, as soon as you feel no pulse, start compressions. And look for an AED. Have somebody go look for an AED, which is an automatic external defibrillator.
Start that.
Exactly. And I heard that they actually used the actual defibrillator on the field.
Yeah,
which
they
is
did.
Sad. And then until they
and we won't know what really happened. The other thing is there's a lot of the parents were telling me that they want to take their kids out of football. They want to take their kids out of baseball. Again, guys, this is kind of rare. It doesn't happen often. But it is important to educate yourself. I think this is one good thing that came out of this is everybody wanted to educate themselves.
For sure.
Had so many phone calls on people asking me, what happened? I don't know what happened. What is cardiac arrest? What's the difference between a heart attack and cardiac arrest? What is this T wave? They don't know. And now they're wanting to learn.
I was talking to Michelle Holt, one of my nurse practitioners, and she was telling me about her being anxious about her son wanting to play football, and she doesn't want to put him in there. She'll prefer maybe soccer or something. But I'm like, I agree with her.
But
as a parent, it's terrifying.
Yeah.
As a parent, it's terrifying. But I also think that a lot of the establishments and administration, NFL, to start thinking about the future plans of how to prevent these type of injuries as well, rather than just us sitting here and not letting our kids enjoy football. No, I would think that we need to think about a better protective system. We talked with Reagan about the Guardian caps, with how we're reducing concussions and how to reduce CTE.
That'll be out next week, by the way, next Friday, guys.
Yes, we will be releasing that episode next week with Reagan Weiss. We're
more advanced now, and we're still playing the same way we did. Now, here's one thing though, AJ. Let's be honest. Most football fans don't really want to change it too much because they're like, come on, man. Like, we like the hits. That's what we're watching it for. Yeah. You're going to make them soft. But it's like, you're saying that. But when he's
until you're 45 and you have dementia at 45 or 50 years old, then you've got multiple concussions. Yeah, bro. I mean, it's a disaster.
You can still play the game, just play it smart, and we just got to be careful. What scared a lot of people is the hit wasn't that hard.
Yeah.
Like, we've seen much bigger hits.
Yes.
Yeah, like if you see where you got hit exactly in that spot, It wasn't a hard hit.
Yep.
And I think what scared everybody is that he got hit and got up and then
collapsed.
Like it was not it was a full collapse.
Yeah.
And right at that moment, I'm like, he went into cardiac arrest.
For sure.
And it's scary when you hear cardiac arrest.
It is terrifying. It is terrifying. But again,
we'll pray for the family. Guys, everybody watching, pray for the family. Pray for him. Let's all hope that he makes it out. And
pray for our young generation to stay safe out there, protect themselves, and watch for the parents. Just watch out for little things, little complaints from your young athletes. You know, if they're complaining of shortness of breath or abnormal chest pain or just collapsing or feeling dizzy. This is, 90% of the time they're okay, but there's a small window that it can be something more dangerous that they need to investigate a little bit.
That's why we do EKGs on every new patient.
Absolutely.
Just to make sure, because you never know when you have a problem.
Yep.
I had their EKG on a patient the other day. She was having a heart attack. She had no idea.
Yeah. Well, that's what's terrifying.
She came in as a new patient.
Exactly.
I'm like, I think you're having a heart attack.
Yeah.
Looked at the EKG. She's like, I'm not symptomatic, asymptomatic.
Yeah.
Got a stress test positive, cardiac cath, stents. You don't know.
Terrifying.
Come see your doctor, especially like people like me and AJ. We'll take care of you.
Yep.
And the other thing, what I was going to say is if you guys like these sports segments, so what me and AJ want to do in the future is called Doc Talk Sports segment. And what we're going to do is cover acute injuries that just happened, right? This person tore his ACL. What is an ACL? How do you tear it? How do you recover? Yep. What are the options? A lot of people requested this. I think it would be awesome to have our own Doc Talk Sports segment.
I think it would be fantastic.
Also in the comments, let us know what you'd be interested for us to talk about.
Definitely. And subscribe. Share our videos. Subscribe. Show us some love. We have been getting a lot of love from our fans, and we love to educate you guys. We love to make you laugh. So keep us in your prayers also. Follow, share, subscribe, and let's take Doc Talk to the next level.